Hello, my name is Rex Reed, and I'm the founder and the president of the Institute of Lean Six Sigma. And I'm coming to you today on something that should be close and near to everyone's heart. Approximately 250,000 people die every year from preventable medical errors, and it's time that we stepped up and did something about it. And nothing illustrates that more than the great mass debate of 2020. Shortly, I'm going to show you a video approximately 3 minutes long of a discussion I had with the Panama City Beach City Council. You will see in due course why we are showing this video, and I look forward to your comments about this process in the near future. Thank you. Good morning, Rex Reed, 202 Gulf Lane. So first and foremost on this, I want to take a moment to express my sorrow for those who have lost loved ones during this pandemic. This is a tragedy. We as a nation will rise from this when the fear has subsided, and we will avenge those people's deaths. Second, we need to follow the science, and the actual science, not the fake science, not the kind that you see on the media. Behind you on that screen, you will see the comorbidity list of the deaths in New York City. It was 86.2% of people died, had either hypertension or diabetes. In Italy, it was 99.1%. We know from the science, factually, that the N95 mask you see on the right side is the only thing that actually works. Okay? Those are in short supply. You may be able to get them. I can't. I talked to a respirator supplier myself. But what I'm going to do today is I'm going to issue a challenge. I'm going to issue a challenge to the City Council. I'm going to issue a challenge to every person who is a masked person, let's say, and especially those on social media. And I'm going to give the city manager $500. Don't gasp, it's not too biloxi money. I'm going to give the city manager $500 to buy and distribute those. If you buy them, I will distribute them myself, because the science must rule the day and not fear. And I will lay out that science as we go, hopefully in the amount of time we have. 67 years of data before the fear consumed the CDC, and people were running, even that did Harvard studies said they are not effective. Fact. Simple fact. First, do no harm. Everyone in here probably learned in high school Newton's law: for every action there's an equal and opposite reaction. This is the opposite reaction of wearing the silly mask that we are now wearing today. You are giving people infections and making them more likely to be sick, and especially for the ladies who never touch their face during the day, generally speaking, because they wear makeup.
Can you address us and not to the audience, please? Thank you, sir. Thank you.
You are making it worse. You are increasing the probability that they will get sick. Next, Newton's law once again. This is what we've done to our nation. We are driving people literally insane, into depression, into alcoholism, and they are dying from it. From a non-factual, science-based approach. This is silly, and it should stop immediately. Asymptomatic spread. Until the political pressure came on, and everybody said it does not happen. Here's our numbers here. They're going down. Surprise. They peaked out around 12 to 25 days past July 4th. Our busiest weekend. Surprise, shouldn't be surprised by that. Here's an island that is totally locked down. Look at their cases. Look when they went to mask. Did that stop it? No. I'll close up in just 1 second. Have one. This is the silliness of what we're doing. We are there. We are not there or there, as someone pointed out.
Thank you.
I'm going to go 1 more second, please. That's okay. Look, I don't believe you guys are being malicious. I know there's a lot of pressure on you, right? And I don't know that I want to sit in your shoes and just hear it, right? But our hospitalizations are trending down. PCB is a strong place. We will get over this self-induced trauma, but it's time not to extend that. And in full disclosure, I am not a doctor, but I am the person doctors hire to evaluate, set up tests, and look at the data and do the analysis. Thank you for your time and consideration. Now we will go to a doctor who will look at the data that I presented and concur with every piece of it. Now watch as he goes through this process of explaining I was correct, what he does with his mask. Now keep in mind, 5 people spoke at this podium before the doctor. They were letting their spittle from their mouth as they speak land on the podium. They were also touching it with their hands. Many of them had masks, pulled those masks off that they had been breathing through, and set them on the podium as well. So let's go to the video and see how the good doctor reacts that believes everyone should wear a mask.
The object of the mask is not to prevent you breathing COVID in. It's from you spreading respiratory particles out to infect the air that other people may walk through.
Ask yourself, what did the good doctor do with his mask? Did he pick it up after touching the podium and fondle it with his hands, almost cleaning his hands on the mask that he had on the podium? Well, let's go to the rest of the video and see what happens.
Out to infect the air that other people may walk through.
He placed the mask back down on the podium, picks it back up, plays with his hands again, and then demands you wear the damn mask. His words, not mine.
So how many deaths are acceptable not to wear a damn mask?
These are the type of medical errors that cost people their lives, and as I pointed out, do more harm than good to the untrained individuals trying to wear a mask in this environment. Now we go to a nurse who claims she is, how shall we say, able to analyze data in an effective manner. Watch what she does with her mask as well and see where we end up.
Florida has had 611,991 cases to date. We've had 10,868 deaths. Alabama, on the other hand, has only had 121,023 cases and 2,076 deaths.
As the nurse points out, Alabama has 1/5 the deaths of Florida. But let us do what our professionals at the Institute do every day and put that data in context. First, Alabama has about 5 million residents. They get approximately 28 million visitors per year. Florida, by contrast, has 22 million citizens and gets about 128 million visitors per year. Now let's add additional context to that data that we also know to be factual. On March 23rd, New York declared a stay-at-home order. At that time, airlines were basically shut down, very few flights moving, only the ones that had to move to keep the slots for the FAA. Flights from New York to South Florida went from 20 a day to 197. Fast forward 30 days later, and 50+% of the cases in Florida were isolated in 3 counties, and 50% of those people were direct travelers from New York, New Jersey area. So once you put the data into context, it's quite different. Also, that drove our case numbers as they spread amongst the citizens of South Florida, making those 3 counties the hot spots and having to take other corrective action. Now we'll cut away from the good nurse because the rest of her information actually goes downhill from here as she quotes modelers that have never been correct once. Just like we heard 2 million people would die, she'll quote the same people that parroted that model. Bottom line, our team at the Institute of Lean Six Sigma can help healthcare professionals do their job in a more effective, safe manner that will save lives. We really need to call on our elected officials and those in healthcare administration at hospitals and doctor's office to seek out our help. You can contact us on the web at the Institute of Lean Six Sigma or on our Facebook page as well. Thank you for taking the time to view this video, and please share. And just remember, every long journey starts with one small step.